Morning, y'all. Time to get going again with more on our shoulder unit. So I'll be back Friday as of right now. Hopefully we have another follow-up with Arkansas Department of Health, I think today or tomorrow. So hopefully that won't change. Hopefully I'll be back on Friday. I do think we need to move our anatomy quiz to Wednesday. It will be Google Forms, just like always. I will monitor it while you take it. However, we've really finished all of the anatomy stuff. So today we're going to do a quick review. I made a new slideshow. We're going to go through this review, and then we're going to talk about muscles. And then we'll do the anatomy quiz on Wednesday, and we'll get started with injuries as well on Wednesday. Okay? So as far as all the anatomy we've gone over so far, we've talked about all the bones, we've talked about landmarks, we've talked about joints. Big thing, remember, the scapulothoracic joint is what we call our shoulder girdle, and that's where our shoulder blade or scapula is interacting with our rib cage, okay? The bones involved are scapula, clavicle, humerus. There were some important points on all of them to remember. We'll make sure we go over that. So the shoulder joint, the glenohumeral joint, is just the scapula and the humerus, whereas that shoulder girdle joint is the sternum, the clavicle, and the scapula. Okay. If you remember on the clavicle, it does have two ends. When we talk about them, we say one's the acromial end, one's the sternal end. I don't care if you can tell the difference between the two of those. I want you to know that it connects from the sternum to the scapula. That's all I care that you need to know. Where it attaches at the scapula is the acromion. Okay. That's what I need you to know about the clavicle. Also, remember we talked about that little tubercle that's in the midway point where those ligaments attach, that conoid tubercle. Now, with the scapula, we did talk about quite a few different pieces of it, so let's go over those again. We talked about how the part where the T, in our golf ball and T scenario, where the humerus connects, that is the glenoid fossa. We talked about how the spine of the scapula ends in the acromion process, which is at the top of the shoulder. We also had the coracoid process, which is down. It's inferior and more anterior. It's in a little deeper as well. We also talked about how really it's a triangle, and that's why I like this picture that we've got right here. Really, the scapula forms a triangle. We have the medial or the vertebral border, which is the part next to the spine. We have the superior border, which is the top, and we have the lateral or axillary border, which is the part that's closer to your armpit, which is the axillary region. Now, as far as the angles go, we talk about this being the inferior angle. We have the superior angle. And then honestly, they call this other one the anterior lateral. Don't worry about that. I never refer to that one like that. So really, it's just superior, inferior. Now, as we look a little bit closer to the scapula itself, we also need to look at the fossas. So if you remember, our spine of our scapula separated the two fossas on the posterior side. We had the supraspinatus, which supra, that's referring to superior, so it's above the spine. Then we have the infraspinatus, which was below the spine. Okay. And then when we flip it over, and what's hard to me to remember about this is that this is actually the anterior side of this bone. But this is where it sits on the rib cage. So we really can never see this unless we remove the ribs. But this whole underside is the subscapular fossa because it's underneath the scapula. Okay, subscapular fossa. And then one of the angles that I told you to get familiar with looking at, this is the lateral view. Okay, this was as if we took their arm off. They are in this picture, our person is looking towards the left side of our computer screen. So this green is the acromion, the red is the coracoid, and then here's our glenoid fossa. Okay. Now with the glenoid fossa, we talked about how it's ever so slightly curved. And so the top and the bottom, we talk about those being tubercles. Supraglenoid, infraglenoid. Just go back to our directional terms. Supra, infra. And then we've talked about these a lot, but I just kind of gave a little bit more definitions to them. Coracoid process, we've already established it's inferior. It's a little bit deeper. Muscles are going to attach there. Acromion is at the end of the spine. Lots of muscle attachment. It touches the clavicle. And then the actual spine of the scapula, it does stick off. It is horizontal and bony. Muscle attachment, it's a good spot for palpations. Just a little bit more, just some more words to help describe these. Sorry that this picture is a little bit blurry. But when we're talking about our sternum, so up at the top, obviously we have a clavicular notch, and that's where we're going to be setting that clavicle. And then really the only thing I want you to know about the sternum is that we've got 3 parts. I always think it looks like a bug. To me, this looks like the head of the bug, the body, because all these little dents are like where its legs go, and then this is like its tail. But we have the manubrium, which is the top part. The body is the middle part, and all these little bumps are where ribs attach. And then the very bottom part that you can kind of feel if you poke down low, that's the xiphoid process. It's the very bottommost piece. With our humerus, remember we talked about having a head and a neck. We talked about a greater and lesser tuberosity. And then we talked about that groove in between, and we talked about how we're going to call it the bicipital groove because that's where the bicep tendon runs. So really there's not a whole lot going on here. That last one, I know you can't see because the picture, that's where that deltoid tuberosity is. So remember that was that halfway point is where that deltoid tuberosity was. And then here, let's see if we can move this picture out of the way a little bit. There we go. So with the glenohumeral joint, this is our shoulder joint. Typical shoulder, what we think of, ball and socket, synovial, just like everything else, golf ball on a tee, super, super, super movable, but very unsteady. Dislocations happen here so frequently, and once they've happened once, they're going to happen more and more and more. That's how we typically see it. I put this picture in here because I really like the way they're showing you where that bicep tendon runs. Obviously, they pulled the humerus off of the scapula so you can get a better look at it, but that tendon runs in this groove, and there's a little tiny ligament that's just kind of like holds it still. Kind of like how in the ankle we had those retinaculums that just, their whole jaw was kind of like tape, and they just taped down tendons and held them still. That's all that this transverse ligament's doing. And then you can see how that long head of that tendon comes all the way in, and it attaches at the very edge of the labrum. Okay, so it's literally right in there, just like the ACL with the medial meniscus. So really, like I said, that's the only reason I put this picture in there. Okay, so our next joint, our acromioclavicular joint, we often see it abbreviated as AC joint. This is between the clavicle and the acromion. Remember, there were multiple ligaments here, and then there were the ligaments from the coracoclavicular ligaments that also help to hold this down in place. It's a gliding ligament. It's still synovial, but it helps to allow the arm to come up above the head. Okay, so you've got to have some movement there. The sternoclaviculars, remember this is where the clavicle meets the sternum. It is an extremely strong, it's also synovial. It has that fibrocartilage disc. It's actually pointing to it here, the disc in between. And remember, you're more likely to break the clavicle than to ever dislocate this joint. Very strong. Then, I thought the picture was on the same slide, but I guess not. So these are the ligaments, and then we've got the picture on the next one, okay? Remember, these ligaments, they look super long. Like, look at all these words. For one, you don't have to spell them for me. But they look super intense. But just remember, it's just naming what they connect, okay? Coracohumeral, what is that going to connect? it's going to connect the coracoid process to the humerus. Glenohumeral, glenoid fossa to the humerus. Remember, we divided this one into 3 parts: superior, middle, inferior. Acromioclavicular, coracoacromial, coracoclavicular. That transverse humeral, make a note there. This is that one that was kind of like the retinaculum that holds the bicep tendon where it's supposed to be. Okay. We had the labrum itself and then the joint capsule. So let's look at all of these. So on this picture, we can see, just going to keep moving this out of the way. We can see all of those ligaments. So these 3 are the glenohumeral. That's why it's got this abbreviation, but it's just showing you superior, middle, inferior. Transverse humeral, holding that tendon down. Coracohumeral, coracoacromial, coracoclavicular. Don't worry about these 2 parts. I don't need you to know the 2 parts. Just want you to know that it's one whole one. And then the last one would be the acromioclavicular. Just remember the bone part names. Don't stress about this. The ligaments come as long as you know the bony parts. Another picture just kind of gives you a more up close. There you've got that transverse humeral wrapped around that tendon. Coracohumeral, 1, 2, and 3 are all glenohumerals, superior, middle, inferior. Coracoacromial, coracoclavicular, acromioclavicular. Use these to practice studying. And then here is that really awesome, great side view. Since the coracoid is right here, which way would our person be facing? Coraco is the anterior, so they would be facing the right side of our screen. So coracoacromial, if you remember, that's the one that makes our magical tunnel. So that's our very important tunnel ligament. Bicep tendon here, coming into the glenoid fossa and the glenoid labrum. And then, I don't know who did this, who painted this, but I've just always really loved this view looking straight down at the top of your shoulder so you can kind of see what you're supposed to be seeing here. So, if this is the acromial end of the clavicle, okay? Means that is your coracoid down there, your first rib. Here's your your coracoid. Here's your acromion process, so that's the spine of your scapula. That means this is the supraspinatus muscle. See how it goes through that tunnel and back it down this way. Then you've got your infraspinatus. It's coming right over here. Okay, and then you've got deltoid muscles on the top here. Where they end would be the deltoid tuberosity. It's just kind of a neat view. They've got the ligament on here very, very lightly just so that you can kind of see what's underneath there as well. Just kind of a different view. So let's take a minute. Let's go through the major muscles of this area, and then we'll finish up for today. So broken down, these are all of the muscles that affect either the shoulder joint or the shoulder girdle. Okay. Most of them are pretty simple. Most of them we know, we might just not know them by these proper terms. So we do have our deltoid muscle, which is the top part of our shoulder. It's this nice rounded muscle that most people try to get. However, most people don't realize that we separate it into an anterior, a middle, and a posterior portion. We also have our biceps, front of the arm, triceps, back of the arm. Your coracobrachialis. It's going to run from the coracoid process down into the middle of the arm. On your back, these next ones are on your back, you have your trapezius, and it is diamond-shaped or kite-shaped. Sorry, they're working on some stuff outside our house. Sorry about the lights. But it starts at the base of your head, comes out to the edge of your shoulders, and then goes down your back and comes to a point just below where your ribs stop. Okay, we separate it too. Upper is this top part, middle is kind of like, think about where your shoulder blades are, and then lower is that bottom point. Latissimus dorsi, we know these as your lats. These are your pull-up muscles or your lat pull-down muscles. But they run from low on your back. They actually come under your arm and end on the front of your body. Okay, that's why if you get these muscles nice and big, you have this weird like bat wing going on over here. You've got teres major. This is a little bitty muscle. It's coming off the back side of your scapula and it's coming to your humerus. This is not a rotator cuff muscle. It is not. This trips up people every year. Teres major is not a rotator cuff muscle. Teres major does the exact same thing that the lats do. It's just smaller. Okay, so while we list them together, lats and teres major do the same thing. Now your rotator cuff is 4 muscles. The acronym I was always taught is SITS, S-I-T-S. Supraspinatus, infraspinatus, teres minor, and subscapularis. SITS. Those are our 4 rotator cuff muscles. Then in your back, you've got your rhomboids. They are the same as your middle trap. So they run from your shoulder blades to your spine. We have a major and a minor there. You have a levator scapularis, and that runs from up on the top part of your neck to your scapula, and it's called levator. Think about like elevate or an elevator. It literally just helps you to shrug your shoulder. That's all it's doing. Your serratus anterior. So this one you can only see if you hold your arm up. It's the zigzag muscle that runs down underneath here. It's usually very prominent in boxers because it has to do with like swinging out to make punches, doing holds, like think about wrestling. But that is that muscle, serratus anterior. It's the zigzag muscle. Serratus, think about like a serrated knife has got like the zigzag edge. Same reason that that's named that. Your subclavius, where would we think that that is just based on its name? Sub meaning below, so it's literally sitting below your clavicle. And then you've got your pec muscles. You've got major and minor. So this is a picture just looking at these muscles. Yet again, I'm sorry, they're doing work outside our house on the lights. On the left-hand side, we have the superficial view. So this is the top layer. Then on the right-hand side of this, we have the deep layer of muscles. So let's look at the left. You can see the kite-shaped muscle. So imagine if it was on both sides. You could see how that would make a diamond, right? That's your traps. You've got your pretty deltoids that come down to a point right here off the shoulder. This is the spine of your scapula, just to give you a little reference point. So underneath here, you can kind of see the infraspinatus from underneath. It's coming from the edge of the scapula. Here's teres major. Remember, it is not a rotator cuff muscle. Underneath teres major, that this little box is prohibiting us from seeing, is your lats. They come underneath here. They stay together. This is your tricep. Then on this side, we've got our rhomboids. Remember, they do the same thing as the middle trap. So they run from your spine to your scapula. Here you can really see that infraspinatus, supraspinatus, levator scapula. This is teres minor. So notice how it's kind of like tucked underneath. That's how we know the difference in it and major. So major you can see down here. Minor is tucked up underneath. And then from the front, we've got your pec muscle. So yet again, left-hand side of the screen is superficial. Right-hand side is deep. We have pec major, which has got tons. Look at all these different muscle parts. So many different parts. On bodybuilders, you can sometimes actually see the line right here that separates. We call this part of the pec the sternal portion because it touches the sternum. And we call this part the clavicular portion because it touches the clavicle. I have seen bodybuilders, though, where you can actually see the line that separates those two chunks. Crazy. Then here's that front part of your deltoid. You've got your bicep down here. Tricep on the back. Remember, bicep means 2 heads, so you can kind of see the 2 heads there. Tricep means 3, so you can see all 3 there. Here is your subscapularis. Oh, I'm so sorry. I'm sitting here calling this your tricep. This is your bicep. We took it apart. This right here is your coracobrachialis. Okay, coracoid coming underneath here to the brachialis. That's the brachial region of the arm. You can kind of see teres major. It ends right here. If the lats were on here, they would also come this same place and end right here on the front of the humerus with teres major. Here we've cut away the ribs so we can see the subscapularis, okay? And if they had not cut it away, your pec minor runs right here too, but they've already cut it away. Just another picture of your rotator cuff muscles. And then these are just kind of showing you everything together. These are the lats. Look how huge they are, and they wrap all the way around and under your arm. Huge muscle. Deltoids, rhomboids, levator scapula. Just trying to give you a full look at all that. Here you can see the traps, the side of them. Here's the lats. Here, though, you can kind of see your serratus anterior. See this zigzag right there? And then on this one, it looks like it's cut away. Yeah, they kind of got it cut away, but it would be underneath here. Here's just a little bit of a breakdown as to what the rotator cuff muscles do, okay? SITS is the acronym. Supra, infra, teres. For some reason, subscap did not fit on here. I will fix this so that way you can at least see it when you're looking at it. The big thing that I want you to remember here is which one does what. Okay, so supraspinatus, top of the shoulder, it acts like a deltoid. It does abduction, so it helps to raise the arm. Infra externally rotates, so that's like cocking your arm backwards like this. Teres minor also does that, cocks the arm backwards. Your sub, which you can't see on the bottom, I'll fix this slide. Your subscap is the only one that internally rotates. So if you had your arm right here, cocked just dead even, infra and teres minor go up or external. Sub is what rotates it downwards. Okay, you don't have near as much movement to rotate inwards. And then here's just another breakdown of those muscles. They're kind of color-coded, so you can see from this anterior view, you can only see supra and sub. And then here we've got supra, infra, teres minor. Here is just a really quick showing you. So here is your deltoid group. Here's your pec major. And you can kind of see it's kind of translucent, and this tiny little muscle underneath, that's pec minor. So it doesn't even come all the way to your sternum. It grabs hold of a couple ribs, but it does go to that coracoid process. Okay. Here you can see the serratus anterior. See that zigzag. You've also got tricep, bicep, brachialis, brachioradialis, all those fun stuff. But really, I just want you to focus on the bicep and the tricep. Tricep means three heads. Bicep means 2 heads. The long head, remember, goes all the way to the labrum. Some more pretty pictures for you guys to look at. I want you to have lots of visuals for this. Lats, teres major. They run together. The one that's tucked away would be teres minor. We know that's the rotator cuff. And then here is a breakdown for your benefit so that you can see exactly which muscles do which things, okay? They're all grouped up. Makes it easier to see them all together like this. And then we did a little bit, I had you do that little write-up about Inky Johnson and his injury, which was to the subclavian artery, as well as the brachial plexus. So this is that group. Brachial plexus, all the nerves that come off this lower part of the vertebrae, comes off the spinal cord. They run together under the clavicle and to supply to the entire arm. Under this area is also where that artery runs. That's the first rib. Remember, there's not much space there. This grouping of it's a big network. It's a big network of nerves that all group together before they branch out. That's what we call plexus. You also have a big one in your lumbar spine, your lumbar plexus. But what happened to Inky is that right here, it was a perfect stretching that snapped his artery and all of the nerves at the same time. That's what caused his injury, was an injury to this right here. I actually had an athlete that injured his brachial plexus, not his artery. He was fine, but he was my athlete with a torn brachial plexus. He had surgery to repair it. I'm actually trying to reach out and see if he would consider doing like a little Zoom call for us and give you a firsthand experience of what it was like dealing with that injury. He did it his 10th grade year of high school. When he was my athlete, he was a senior, and he actually got cleared and played football and baseball. He's actually a really, really good baseball player. But anyways, I'm going to see if I can get in touch with him. Him and my husband stay in touch all the time. I haven't talked to him recently, but my husband said he's going to check with him for us. So maybe we can get a little firsthand knowledge on that. But that is it. So Quiz Wednesday. I'm going to post that in your Google Stream too, but Quiz Wednesday.